Good afternoon. We're coming down to the end of the month of July here. Today's July the 30th of 2020, and we're going to hit an important topic today. This is diabetic macular edema, and very important topic. It's kind of an extension of the whole discussion of diabetic retinopathy, because you can have diabetic retinopathy without having diabetic macular edema. And in fact, if you have diabetic retinopathy, particularly if it's in the early stage with the non-proliferative diabetic retinopathy, as long as there's no involvement of the macula, you won't really notice any changes in your vision. And the only way to detect the non-proliferative diabetic retinopathy is by having your yearly eye exam. And again, I want to encourage you in each video to have a yearly eye exam, a thorough eye exam that includes dilating your pupils so that your retina can be viewed in detail. And often when we detect something wrong in a retina, whether it's a diabetic patient or not, we'll have that person back more often. And if we're truly concerned about it, we refer them to a retina specialist if they are at a stage where they need some sort of laser therapy or other treatment for a retinal problem. We get them right in on a ASAP as soon as possible type referral, or even an emergency referral in some cases. But the retina is nothing to fool around with. But again, I'm not, with all of these videos, I'm not trying to frighten you. I'm trying to motivate you into taking control and not just sitting back and waiting for things to happen to you as a result of being diabetic. Trying to encourage you to take control. And of course, my own story is that I took control of my diabetes without medication. My A1C was way too high, and I got it down to a really good number without any medication. But it takes a lot of dedication and determination to do that. But everyone watching this is fully capable of doing that. So let me explain about the macula. I'm going to go back to my poster that I've used several times, and we're going to the back of the eye now. And let me get this focused on the right part here. And the macula is this, you see that kind of little dimpled area there, a little indentation. That's the macula area. The very center of the macula is called the fovea, but the macula is the very center of the retina, and that's where all your sharp central vision comes from. When you can see 20/20, or you can see road signs when you're driving, particularly driving at night or any time. But when you see things real sharp, 20/20 or better even vision, that's done with this center part of the retina, the macula. The peripheral parts of the retina are not capable of that sharp of vision. The reason the macula is capable of that sharp of vision is because of the high concentration of rods and cones, the high concentration of nerves in that part of the retina. The nerves are much more spread out in other parts of the retina, and they're not capable of seeing real sharp vision like you get in the macula. And that's why we are so serious about protecting the macula, the central part of your vision, because if you lose vision in that part of your retina, it's a big deal. It may keep you from, particularly if it happens to both eyes, it may keep you from being able to get your driver's license renewed. It may keep you from being able to work. And so it's very, very important to protect this central part of your vision. Again, you can have the effects of diabetic retinopathy out here in the peripheral parts of your retina, way out here, and not have that severe an impact on your day-to-day life. But if it affects the macula, it's getting serious. And so that's that's why this is such an important topic. And if you remember when we talked about diabetic retinopathy, I talked about how you have these tiny little blood vessels that feed and nourish the tiny nerves that are in the retina, and that's true of the entire retina, including the periphery and the macula. Now, if there's a problem with the blood vessels in the macula, if they begin to leak fluid, if some of those little delicate blood vessels become damaged, edema means swelling. So diabetic macular edema means swelling in the macula, and that means fluid is collecting there, and this can begin to distort vision, and it can be a real problem. There are ways to treat it. Initially, one of the ways of treating it was with lasers. Lasers are still used, but then there's also injections. And I know having an injection in your eye, having a needle put in your eye or very close to your eye, it's usually in your eye, is not a pleasant thought. But if you're faced with having a needle put in your eye or going blind, you probably want that needle. And so there are treatments. So, if you happen to have early stages of diabetic macular edema, there are treatments, lasers and injections. The injections are called anti-VEGF injections. And VEGF is vascular endothelial growth factor. And that VEGF, or vascular endothelial growth factor, is what's causing a lot of the problems with those little tiny blood vessels. And so anti-VEGF counteracts the VEGF. And that's one of the treatments that's very, very effective with this. It has great results. I've personally have seen patients that were almost blinded by diabetic macular edema go back to 20/20 or close to 20/20 vision again after receiving these injections. Now, the injections are not a one-time deal. Those have to be repeated periodically, and that how often those are repeated are determined by the retina specialist that takes care. Only retina specialists do that. There's no other types of eye doctors, not optometrists or ophthalmologists, no general ophthalmologists or other types of ophthalmologists. It's a ophthalmologist who's a retina specialist that takes care of this thing, and that's who you want to see if you ever get this type of problem. But just know that it is treatable. And I guess my emphasis on everything is not only is it treatable if you get it, but if you don't have it yet, or if you don't have some of the other complications that go along with being diabetic, these things are preventable by getting your blood glucose under strict control. It's very, very possible to avoid having these kinds of problems if you keep your blood glucose stable and in the normal range. And that's what I'm doing personally. And, I don't plan to ever have, I guess nobody plans to have these kind of complications, but I don't have any reason to think I'll ever get diabetic macular edema because I've changed my way of eating for the rest of my life. I'm 64 years old now, and I plan to eat the way I eat today. I plan to eat that way for the rest of my life. And I'm counting on that protecting me from diabetic retinopathy, from diabetic macular edema, and all sorts of problems that come along with diabetes, kidney disease, and peripheral neuropathy, and everything, all the different, the heart disease and strokes. I'm really counting on, I'm staking my life on the approach that I've taken. And Dr. Jason Fung was a major part of that for me. He's a kidney specialist, and and I specialize in eyes. And so if you're wanting to prevent these serious things, I'm here to tell you, I believe 100% it is possible to prevent these kinds of problems, but they can be serious. You can be blinded by problems from out of control diabetes. So please take these issues seriously. Please do everything within your power to take control of your own health. And we're almost coming to the end of this series. To some degree we are, but I want to do one more video after this that's going to be on macular degeneration, since we were just talking about the macula. Macular degeneration is separate. It's not the same thing as diabetic macular edema. They're two separate problems, but they're both very serious because they involve the macula, that central part of the retina that I showed you and talked about. So I think it's real important while we're covering this to also talk about macular degeneration. So that'll be the next video. And there's actually some exciting new research coming out on macular degeneration that I want to share with you. And so I want to dedicate a full video to that. And but again, just rest assured that if you already have diabetic macular edema, there are treatments for it. There is still hope, I promise you. But for those of you who don't have it already, you're in the driver's seat. Take charge, get control of your blood sugar by changing your diet, and you can do this. I promise you can. And so I'm going to finish up by saying, live healthy and finish strong. Thank you.